Welcome to the Hazardous Marine Animal Awareness Module. Commercial prawn trawling occurs around much of the coastline of mainland Australia. Using small mesh nets, prawn trawling results in the capture of many diverse marine animals, in addition to prawns, some of which can cause temporary injury and discomfort, and others that can cause permanent injury, disability, or even death. This module cannot hope to cover all hazardous marine animals that may be retained in a prawn trawl, particularly given their number and diversity. However, until experience is gained, a wise approach for any new crew is to consider contact with any marine animal a potential health hazard, and if in doubt ask an experienced crew member or the skipper about the hazards of contact with an animal. Even experienced crew occasionally get stung, bitten, or suffer other ill effects from contact with a marine animal, and inexperienced crew are at higher risk until they know what animals to look out for. Asking for advice about contact with a marine animal is not a sign you are weak. Note that even minor injury, for example puncture wounds from prawns or fish spines, can result in serious infection, sometimes affecting your ability to work. Other crew may then have to pick up the slack. In the worst case, you may lose your job. You may even require hospitalization. It is therefore vitally important to treat any bite, sting, or puncture as a potentially life-threatening injury, and to know the appropriate course of action to protect yourself or others from harm. Many fish and other animals have the ability to cause injury, including lacerations from sharp teeth, sharp gill covers or rakers, claws, and skin puncture from spines. Usually these injuries are relatively minor, and treatment includes cleaning the wound, use of an antiseptic, covering with a sterilized band-aid or bandage to keep the wound clean, and taking steps such as wearing gloves to keep the wound dry. Avoidance of these animals is the best approach, as this eliminates the risk, although this is of course not always possible. Wearing appropriate personal protective equipment is the next best course of action. This includes wearing gloves and aprons when sorting the catch and removing fish enmeshed in the codat, and wearing enclosed footwear at all times on deck. In many prawn fisheries, the capture of sea snakes is not an uncommon occurrence. Sea snakes are highly venomous and extreme caution should be taken. They are not always easy to see amongst the prawns and fish on the sorting tray, particularly at night. Sea snakes may also be caught in tri-gear, and will be extremely agitated and active. They can sometimes fall out of a net or cod end as the cod end is hauled on board, landing on unsuspecting crew below. While the likelihood of being bitten by a sea snake is low, and most individuals survive the bite, sadly this is not always the case. Sea snakes must only be handled if absolutely necessary and only by an experienced person. It is preferred that an extended grabbing tool is used to increase the distance between the snake and the person handling it before it is thrown overboard. This will reduce the chance of getting bitten. Other options include grabbing the tail and quickly flicking the snake overboard, after ensuring no one else is in the vicinity. Light pressure behind the head with a shovel or other implement to incapacitate the snake before picking it up behind the head is another option, although again only experienced individuals should attempt this action. Immediate action to treat an individual bitten by a sea snake is essential, even individuals that do not immediately display any symptoms. A delay in treatment could result in loss of life. The bite site may display paired puncture marks from the snake's fangs, although one or more single puncture marks may be present or just a small laceration or scratch. The bite can be painless but may continue to bleed. The victim may experience headache, nausea and vomiting, abdominal or chest pain, drowsiness, blurred or double vision, breathing difficulties and cold, pale skin. The victim may be distressed and highly anxious. The medical response to a sea snake bite is as follows. Stop work, take the victim into the galley to sit or lie down, keep them still, and make every effort to calm and reassure them. Promptly apply a bandage or dressing over the bite site to stop the bleeding and then a compression bandage over the bite area and entire limb. This bandage is applied from the fingers or toes in an upward direction as high up on the limb as you can go. The bandage must not cut off blood circulation in the bitten limb, but should be tight enough so two fingers cannot fit easily under the bandage. This step is very time critical. The compression bandage must be applied immediately because it will dramatically slow the spread of venom through the body, buying valuable life-saving time. Note that if you do not have compression bandages, clothing or towels can be torn into strips and used instead. It is also considered important to not wash the venom off the bitten area. There is little risk that venom on the skin will enter the body. In any case, washing the wound takes time that is better spent applying a compression bandage. The affected limb should then be immobilized with a splint or improvised splint, such as a plank of wood or folded piece of cardboard. If bitten on the leg, both legs can be bound together with bandages. A pen or marker should then be used to mark the bite site on the outside of the compression bandage so the doctor immediately knows the location of the bite before removing the bandage. Two final points to make. First, if someone is bitten by a sea snake, emergency medical assistance must be sought immediately while care is being provided, and steps must be taken to evacuate the individual. Second, there have been reported serious infections from a sea snake bite, without any ill effects from the venom, and these so-called dry bites have still required hospitalization. For this reason, any suspected sea snake bite should be treated as such, and steps taken immediately to administer first aid, seek medical assistance, and to evacuate the individual. The blue-ringed octopus and conch shells are two deadly sea creatures that are occasionally caught in a prawn trawl. With one key distinction, the venom of these two creatures has similar effects on the body and can be treated in much the same way. The key distinction between the two is that a bite from a blue-ringed octopus is often painless while a sting from a conch shell causes severe pain. However, symptoms from both are typically characterized by numbness of the lips, tongue, face, and neck. This may be followed by progressive muscle paralysis, which in extreme cases can paralyze the muscles required for breathing, causing breathing to stop. The first aid response for both is as follows. Stop work, take the victim into the galley to sit or lie down, keep them still, and make every effort to calm and reassure them. Alert other crew to the presence of the animal and take steps to discard it overboard, using a shovel or perhaps the deck wash. Contact emergency services for assistance and consider steps to evacuate the individual. Treat the affected area the same way you would a sea snake bite and continue to monitor the victim for breathing difficulties. If the victim stops breathing and becomes unresponsive, clear the airways and provide mouth-to-mouth resuscitation. Do not stop until medical assistance has arrived or the individual has sufficiently recovered to breathe on their own. The victim may still have awareness but cannot breathe on their own or respond to you due to muscle paralysis. There is no antivenom for a blue-ringed octopus bite or conch shell. Stingrays, scorpionfish, happy moments, and some catfish are just a few of the species that have sharp barbs that can inject venom deep beneath the skin. These stings are usually characterized by intense pain, swelling at the affected area, an open wound, with possible barb fragments, and sometimes irrational behavior and panic. The first aid response is as follows. Stop work, take the victim into the galley to sit or lie down, keep them still, and make every effort to calm and reassure them. Alert other crew to the presence of the animal and take steps to discard it overboard. If the barb is large and embedded in the wound, it should not be removed. The barb may be helping to stop bleeding, which could otherwise complicate matters further. That said, an experienced first aider may make a judgment call that removal of a small barb is appropriate. Next, place pressure around the barb with your hand or a bandage to help stop the bleeding. Place the stung hand or foot in water no hotter than the individual can comfortably handle. Hot water will help break down the protein in the venom. Contact emergency services for assistance and advice, including whether it is safe to remove the barb or not. Hot water may need to be applied for 20 minutes or longer. Monitor the individual for breathing difficulties. If they stop breathing and become unconscious, clear the airways and provide mouth-to-mouth resuscitation until medical assistance arrives. Whilst relatively uncommon, bluebottles and box jellyfish may occasionally be caught in a prawn trawl. In particular, they may be fouled on trawl netting when the trawl is on the sea surface, increasing the stinging risk when the trawl is hauled on board. Contact with a bluebottle, sometimes called Portuguese man-of-war, may result in a painful sting that lasts for some time. The affected area should be immersed in hot water for 20 minutes or longer. Tentacles can be removed using tweezers, and pain may be relieved by ice packs or anesthetic creams if hot water is unavailable. Vinegar has little effect on bluebottle stings. Box jellyfish cause immediate excruciating pain, as well as whip-like sting marks on the skin, redness, and swelling. Other symptoms can include nausea, vomiting, sweating, headache, and collapse. Breathing may also stop and cardiac arrest may occur within minutes of being stung. The sting of several species of box jellyfish, often referred to as irukandji, found in Queensland, Northern Territory, and Western Australia can result in so-called irukandji syndrome. The onset of this syndrome may not present for up to 45 minutes after an individual is stung. Symptoms are similar for a box jellyfish but also include intense muscular cramping pains in the lower back, restlessness and anxiety, including a sense of impending doom and certainty that they will die. A sudden dangerously high increase in blood pressure and heart rate may occur, followed by collapse and in some instances, death. First aid treatment must be applied immediately, including pouring vinegar over the affected area for at least 30 seconds. The area can be washed with seawater if vinegar is unavailable. Do not use fresh water or alcohol, and the tentacles can be removed by a hand wearing gloves. Seek emergency assistance and keep the individual still and calm. An ice pack on the affected area can help reduce the pain. Give CPR if required. Whilst the capture of sawfish and other large animals has been largely eliminated using TEDs, occasionally they are caught in the net ahead of the TED and need to be returned to the water. Needless to say, this process requires extreme caution, and sawfish that appear lifeless can move suddenly and cause injury in a split second. These animals should only be handled by experienced individuals. Perhaps the easiest way to release them is to lift the net so they slide forward and out through the trawl mouth. On a prawn trawler, this may also require lowering the trawl boards into the water. However, sawfish are particularly prone to becoming snagged in the net, which makes their removal particularly difficult. This may require bringing the net on board to ensure that netting is slack and then cutting an opening in the net to remove the animal. Extreme care is required to avoid a thrashing tail or bill. Some experienced individuals manually bend the dorsal fin as this seems to stop them thrashing about. A rope can then be placed around the tail to lift the animal upwards and overboard. A slip knot should be used to ensure the animal is released quickly without any rope remaining around the tail. Sawfish are protected by law and deemed endangered, so every attempt should be made to release them alive as quickly as possible, without compromising crew safety. The process for removing sharks and other large animals is similar to that for sawfish. Excellent! You have completed the Hazardous Marine Animals module. Let's now review the material that we covered.